I'm going to assume anyone listening to this is already on board with the idea that taking menopausal hormone therapy is a good idea. So let's just start with that baseline, and if you disagree, that's fine. So if you've decided that you want to do that, how do you get it? How do you pick the right dose? How do you know if you're on the right dose? The idea that pellets are unstable and cream or spray or patches are not, that's just wrong. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and a certified menopause practitioner. I have dedicated my whole working life to taking care of women in perimenopause, menopause, and beyond. Women like me who have the goal of feeling great now and also building the healthiest 90-year-old version of ourselves, because we want to live a long time and feel good in the meantime, reduce the risk of preventable diseases, and then keep ourselves mobile, active, and doing the things we love for as long as we can. So everything I talk about has something to do with that. And today I'm going to talk about something that is quite confusing. And I'm guessing if it's confusing for me, it probably is for you too. I'm going to assume anyone listening to this is already on board with the idea that taking menopausal hormone therapy is a good idea. So let's just start with that baseline, and if you disagree, that's fine. I've got lots of other videos about the science behind why that might be a good idea. However, once we've decided that we're going to do this, right, we're talking about estradiol, which is the primary estrogen that we produced from our ovaries all of our lives, progesterone, which is the wonderful hormone that we make after we ovulate, and then we make messes of it when we're pregnant, and testosterone, which you all know by now, we actually make a lot more of than estradiol, and it's a very important hormone for lots of things. So those three hormones. So if you've decided that you want to do that, how do you get it? How do you pick the right dose? How do you know if you're on the right dose? And just to make things more confusing, every different delivery method has a different dosing schedule. Let's start with estradiol. So this is the hormone, again, we've made from our ovaries all of our lives. One thing that we know from lots of data, lots of studies in the past, even young women on birth control pills, we know there's a slightly increased, very tiny increased risk of blood clotting events when we take estrogen by mouth. So because there are other options, we generally don't want to do that. So let's just take that one off the table. And if you are taking an estradiol product by mouth, I would stop and switch it over to one of the others. In the old days, we had no other options, but now we do. So we want to go with the safest alternative, and that's going to be some kind of transdermal across the skin or not by mouth form of estradiol. So that could be a patch, a cream, an injection. Gosh, you could get little drops that go under your tongue. You could get a pellet, the little things that go under your skin. Any of those would be safe in that respect because they're not taking that primary, what we call first pass through the liver. Now, if you take a pill, it's got to go through your stomach, and then it's got to take a big trip through the liver before it gets into your bloodstream. And in doing that, it causes some problems. We've only got one liver. We don't want to give her extra work to do, and it messes up our blood clotting factors. All right, so let's take that one off the table. So patch, cream, we can get those from regular pharmacy. So the FDA has approved estradiol in the form of a patch. Great product. There are a bunch of different doses. I'll talk to you about that. You stick it on your skin. Lasts for about half a week, 3 to 4 days. So for example, you change it on Monday and Thursday or Tuesday and Friday, but you're basically wearing it all the time. Stays on through exercise, stays on. Gosh, I was even swimming when I used mine. Probably comes off if you swim a lot. So short of that, it's good for normal bathing, normal exercise. And then you're getting estrogen all the time without it going directly through the liver. So that's one option. The FDA's also approved a gel called Divigel. A little packet, put it on your arms, go like that once a day. That's great. Now you have to do it every day, kind of dry your arms, but many women like that. There's one called Eva Mist, which is a little spray. There's some other generics, similar idea. Suffice to say, you can get FDA-approved estradiol in a transdermal form from any pharmacy, and that's perfectly great. Now, you can also get estradiol from a compounding pharmacy, and that's a type of pharmacy where the pharmacist is making something a little bit more specific. For example, the FDA has not approved estradiol in pellet form yet. So you can get testosterone or estrogen pellets made by very reputable, very high-level compounding pharmacies. And just to say, compounding pharmacies have different levels of reputability, just say, and these come from very highly reputable compounding pharmacies that have incredibly high levels of internal validation, testing, and so on. So it's just not correct to say that compounding pharmacies are bad and FDA-approved drugs are good, and we've talked about that before. However, the regulation is a little bit different, so you want to be careful. So you could get estradiol from a compounding pharmacy in the form of a pellet, again, a cream. They can make all of this stuff, but different ways to get it. Now, within these, the dosing is completely different, and this is where it gets a bit tricky. So some doctors say, in fact, the American College of OB-GYN has the opinion that there's no need to check hormone levels on menopausal women and to give the amount of estrogen that makes symptoms go away. Now, I believed that was a good idea for a long time until I started checking blood levels and saw that they were all over the place. So I do not agree with that. I do think it's important to check blood levels because I'll tell you why in a minute. The dosing is so crazy and different between one product and the next that if we didn't check blood levels, I don't know how on earth we would know that we have you on a safe amount that's going to be beneficial for your health. So my opinion is you definitely should check blood levels. Here's an example. One would think, and I was led to believe, that if you're wearing an estradiol patch, you have it on all the time, your blood level of estradiol should be pretty much the same all week, right? That's what they lead you to believe. That is so far from the truth. We've checked blood levels on the same patient, on the same patch, and it's been from 0 to way too high because there's a million things that affect how we absorb things through our skin. The temperature, whether there's a little water bubble underneath it, how old the patch is. You get much higher levels the first day than the fourth day. Lots of other things. What you might have put on your skin, whether you took a bath or a shower, if you exercised or you didn't. So there is fluctuation even with a patch. And not to say there's anything wrong with fluctuation because our estrogens fluctuated all of our lives. But I do want to just point out the idea that it's stable is false. Cream. You're putting on once a day. So guess what happens? The level goes up really high in the first 2 hours, and then it drops down. So if we drew your blood 2 hours after you put the cream or gel on, you'd get a sky-high level, and then if we checked it 24 hours later, it would be close to gone. Again, there's nothing wrong with fluctuation because it's fluctuated all of our lives, but we don't want it to go from way too high to 0. So this happens sometimes. And so if you're someone who's using a cream or a gel and you're not feeling stable, that could be something to consider. Now, most patients do just fine with Divigel. There's nothing wrong with it. I'm just pointing out that the levels are all over the place, and this might be why there's a suggestion not to check, because most doctors don't really want to see that their patient's estradiol is 800, which is way too high, or 0. And so they just say, well, just put it on and off you go. Well, I don't know. There's an argument, and it's a good one, that what we're seeing in our blood doesn't necessarily indicate what our cells are seeing, because just because our blood levels are 0, the cells have still got some estrogen in them from the day before. So all of that's true, but just to say, I think checking blood levels is a good idea to make sure we're not at some crazy high or crazy low level. Now, pellets, I don't know why people like to get so upset about pellets. It's the same exact stuff. It's bioidentical estradiol in a benign powder that's just put under your skin through a tiny little poke in the skin. I have one in my bottom. It's not perfectly stable, but again, nothing is. It's a whole lot more stable than these other options. But yeah, it goes up, it spikes a little bit in the first 2 weeks, it stays relatively stable, and then it starts to decline. And so there's a little bit of up and down with a pellet, depending on what brand you use, the way they're made. Some of them are pressed in these concentric circles, so you might see a little bump when the outside of the next circle dissolves and so on. But again, our hormones have been going up and down all of our lives. And the idea that pellets are unstable and cream or spray or patches are not, that's just wrong. This is where it gets really funny. The dosing, how do you pick the dosing? So a patch, let's go back to patches. You might see a number like, for example, a common dose to start on would be 0.05 milligrams a day. Okay, so you're getting 0.05 milligrams a day. That's a good amount. The equivalent to that in a pill would be 1 milligram a day. Multiple times higher, because most of it's lost in the process of going through the liver. So the idea is that the patch you're going to get much more of, and the pill you're going to lose most of it. Okay, so hold that thought. So in a patch you're getting 0.05 milligrams a day. Well, in a cream, generally it's the same dosing as a pill, like 0.5 milligram a day or 1 milligram a day. So the difference between 0.5 milligram and 0.05 milligrams is 10 times, right? So the idea is that you lose 9/10 of the cream and you're getting 100% of the patch. And then you're not supposed to draw blood levels. Really? I mean, you can kind of see why this is a little bit of a cowboy experiment. How do you know how much cream you're getting? Or how much patch you're getting? Or how much anything you're getting, unless we draw your blood? I don't. And I can tell you, having drawn blood for many years, it is all over the place. Which is why I personally use a pellet, because, yeah, there's a bit of variation during the 3 months, but not nearly that much. So, point being, it probably doesn't matter much if we have fluctuations up and down again, because that all of our lives, our estrogen went up and down, but we don't want it to be crazy high and then zero within a 24-hour period of time. So again, cream, you lose most of it. Pill, you lose most of it. The patch, the idea is that you don't lose most of it, but sometimes you do. I've got patients who are wearing a patch and their estradiol is 0. They're just not getting it at all. So we've just really got to check, I think. So that's kind of a fun fact about estradiol. The dosing is 10 times different depending on what product you choose. Well, the same thing applies to testosterone. You cannot get testosterone in an FDA-approved form yet for women, which makes no sense because men have over 18 types of FDA-approved testosterone, including a cream, a gel, a solution, a nasal spray, even a pellet, yes, and so Testapel is FDA approved, so the FDA has approved pellet technology. They've recognized that it's good. They approved it for men. I mean, it makes no sense. I made another video about that, so I won't bore you about that. But the idea that pellets are not FDA approved and that makes something wrong with them is just false. Testosterone is FDA approved. It's a natural hormone. We've had it our whole lives. It's approved in multiple forms for men, including pellet form. So, what's the difference with men and women except that our dosing is 10 times lower? So with testosterone, we've got the same choices with the caveat that we don't have the FDA-approved ones. So all testosterone products have to come from a compounding pharmacy right now, which is annoying, but here we are. I did not make the rules. If I made the rules, they'd all be FDA-approved. Here's something funny. The American College of OB-GYN, that's the board that kind of tells us what to do as gynecologists, and they're fantastic, and I love them, and they do amazing research, and they're wonderful, but sometimes they say some things that don't make sense. So here's one. The American College of OB-GYN has recognized and suggests using transdermal testosterone for the treatment of low libido, also called hypoactive sexual desire disorder. That's the fancy name for low sex drive. Because many studies have shown that using transdermal testosterone helps with that issue, helps with libido for postmenopausal women. So they said, great, let's do that. Let's give women transdermal testosterone. But they simultaneously say that they do not approve compounding pharmacies. So then how on earth do we get it? So what they suggest, this is where it gets really funny, is that you get the FDA-approved male products and just use 1/10 of it. Well, I don't think they actually have gone to the pharmacy and tried to do this. I have. So if you get a male patch and try to cut it into 10, well, it's not going to be perfectly accurate, and you're going to have all these little pieces of plastic. It's hard to do, and by no means is that accurate. I mean, it's impossible to do that accurately. So that would be one way. And for some reason, that's better than compounding. Or you could get the little packet of male cream and somehow divide that into 10. I mean, that would be impossible, and if you tried it, you would be so far off from 1/10 it wouldn't even be close. So somehow that's better than compounding. You could use the male nasal spray, but you can't divide that by 10. You can see where we're going. I mean, how on earth can you use FDA-approved male testosterone products and divide the dose by 10 accurately? You can't. It's impossible. The male Testapel, it only comes in one dose. You can't divide that by 10. So they're simultaneously recognizing that it's really good and women need it, but then also saying that we can't use compounding pharmacies, so therefore it's impossible to get it. I mean, sometimes things don't make sense. So in the current moment, we have to use our minds, and out of those two choices, cutting a male patch into 10 or using a very good compounding pharmacy, by far that's going to be much more accurate. And either way, we would want to draw blood to make sure that we're getting into the right range for women. So physiologic range for women means not too high, right? Because we all know testosterone too high causes a lot of adverse side effects. Okay, so how much should we get? Well, we're just going to assume that we've agreed that testosterone's good because there are studies proving that it is, and then how much do we get? Well, pellets have a little calculator that one could use, and I don't use that because I think that's way too high. In our office, we use 1 to 1.5 milligrams per kilogram of body weight. Okay, so no more than 1.5. I would start with 1 milligram per kilogram. That's not very much. Let's take a woman like me who's getting 50 milligrams over 100 days. So I'm getting 50 milligrams over 100 days. Obviously, that's half a milligram a day, 0.5 milligrams a day on average of testosterone over about 3 months and a half. So let's just say 100 days for easy math. 0.5. Okay, so if you get testosterone cream, you would get 10 times that much. Again, so 5 milligrams or even 10 milligrams would be the recommended amount in a cream. In Australia, their equivalent of the FDA has a product that's available from pharmacies approved by the government, and it comes in 5 milligrams, and the instructions are to use 5 milligrams once a day, and then increase it to 10 if you want to. Well, that's kind of a big range. And again, when you put this stuff on, we've done this. So if you put 5 milligrams of testosterone, that's 10 times what's in my pellet, just saying. Do not draw your blood in the first few hours because it'll be crazy high. If I put 5 milligrams of testosterone on my arm or inner thigh or back of my calf or wherever you want to put it, and then I drew my blood 2 hours later, my testosterone level would be 1,000. It would. We've done this. Now, 24 hours later, it would be 50. So that's fine. But just to say, the idea that many doctors are suggesting that testosterone cream is better or safer or more stable or any combination of words that you want to use than a pellet, it's just wrong. When I get my pellet, if I checked it 2 weeks later, and we're doing this study in our office right now, actually, it does shoot up a little bit, not nearly that high, though. Of course, everything goes up a little bit at first. Any pill you take, it's going to be a bit higher for the first couple of hours, and then it'll settle down. Whether it's aspirin or thyroid medicine or cholesterol medicine, everything, your vitamins, everything goes up, and then it settles down. Creams go up super high because the skin absorbs it very rapidly, and then it dissipates quite quickly. What's some other ways? Well, there's a little thing called a troche, which is a lozenge that you put in your mouth. The idea with that is it dissolves into the tissue on the inside of your cheek, and very little of it gets in your stomach, and so that's good for the liver. Well, we see the same thing with troches. If we measure your blood levels 2 hours later, it's going to look crazy high. And is that terrible? No, not really. I mean, hormones go up and down, but again, the idea that these non-pellet ways of getting hormones are more stable is false. Try it. To put a troche in and have your doctor draw your blood 2 hours later. Here's a curious thing. Most doctors who understand this at all will tell you, do not get your blood drawn for at least 6 hours after you've used a cream or a troche, because otherwise you will scare yourself with the result. I mean, that's a good idea, but the fact is it's crazy high in that first 6 hours. Just because you're not checking it doesn't mean it's not arguably way too high. So these are all valid suggestions. I think they're all fine. I have patients who use a cream. I have patients who use a troche. I have patients who use pellets. They're the same stuff. There's some fluctuation. That's okay. But I'm definitely not on board with not checking blood levels. I think you have to. I mean, how on earth would you know otherwise? In my opinion, you couldn't possibly know. And then progesterone is a little bit easier. Now, progesterone we do take by mouth because it has this particular side effect of making us sleepy, and most people love that because most of us can't sleep. So if you take it by mouth, yes, you need a really high dose compared to what you might use in a cream or something else, because it is mostly metabolized by your liver, and your dose you get in your bloodstream is not that much. But taking 200 milligrams of progesterone by mouth is absolutely safe. The liver doesn't mind it. It makes you sleepy. We intentionally want to make use of the fact that it goes up really high for a few hours while you're sleeping, and then it drops down. So in that particular situation, it's fantastic that it goes really high and then drops down, because we want it really high at night and not during the day. That's why I'm not a big fan of progesterone cream, because you'd be sleepy if you were getting enough to make a difference, or any other kind of progesterone that's being delivered all day long. Progesterone's a bigger molecule. It doesn't absorb very well through your skin, so we don't see the benefit for sleep and other things. So I'm not such a fan of that. I just give it by mouth. I take it by mouth myself. And yes, we know it's high at night, lower in the morning. That's fine. All of these hormones go up and they come down. So we can use that to our benefit if we want to get the benefit during sleeping hours. But just don't believe the hype that pellets are bad or wrong or less stable or any of the above, because I promise you, if you measured your blood after putting on that testosterone cream that a lot of my lovely colleagues recommend, if they measured it, it would be sky high. So they say don't measure it. Well, that's one opinion. So anyway, I hope you enjoyed this conversation. It's really confusing. 10 times more in a cream than in a patch, trying to take the FDA-approved male stuff and cut it into 10. We've got the American College of OB-GYN saying, yes, testosterone's really beneficial for sex drive. Let's use it. But we don't have any products that you can use. Now, you can fly to Australia and get the cream. Most of us don't want to do that, but you could. Or you could just go to your local compounding pharmacy, and they can make it for you. Anyway, you don't have to do any of this. I just want you to be educated when you make a decision. So now you know more than your doctor when you're wondering what dose you're getting and whether it's the right one for you. I do not know how you would possibly know that unless they drew your blood. And if you're using a cream or a troche, tell them to wait 6 hours because it's going to look crazy high before that. And if you're using a pellet, doesn't matter what time of day you do it because it's reasonably the same throughout the day. Sounds good to me. That's why I have pellets in my bottom. Anyway, I hope you enjoyed this video. If you learned something, don't forget to share it with your friends, and I can't wait to see you next week.